Hello and welcome to Grand Rounds for the Minnesota Regional Spinal Cord Injury Model Systems, or we call it MINSCIMS for short. Thank you all for joining us today. MINSCIMS is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. And they fund this to support innovative projects and research in the delivery, demonstration, and evaluation of medical, rehabilitation, vocational, and other services to meet the needs of individuals with spinal cord injury. Next slide, please. MINSCIMS represents an exciting partnership among the following Minnesota institutions. We have Courage Kinney Rehab Institute in Minneapolis, Mayo Clinic in Rochester, Regions Hospital in St. Paul, and the University of Minnesota in Minneapolis. Next slide. Our community collaborators include Minnesota Spinal Cord Injury Association, Unite to Fight Paralysis, Get Up, Stand Up to Cure Paralysis, Paralyzed Veterans of America, United Spinal Association, and the North American Spinal Cord Injury Consortium. This system collectively provides multidisciplinary continuum of care for people with spinal cord injury, including emergency medical, acute care, acute rehab, and post-acute services. My name is Angie Philippus, and I will be the moderator of today's session. I'm a research project specialist in the Department of Rehab Medicine at the University of Minnesota Medical School, and I'm part of the MINSCIMS. Next slide, please. A few housekeeping things to go over. So the University of Minnesota has organized the CME for today's webinar. Please see the chat for information on how to record your attendance and claim CME credit for attending this webinar within 24 hours of the event. This meeting is being recorded and will be posted on the MINSCIMS website. To earn CME credit for today's presentation, please click on the link in the chat. And due to the number of registrants for today's webinar, we have placed phone lines on mute to reduce audio feedback. However, we do welcome and encourage audience participation. Just do so using the Q&A function. If you have technical or logistical questions, we ask that you submit those in the chat to Dan Kelly. We extend a huge thanks to folks at the University of Minnesota who do work behind the scenes to make these webinars possible. Next slide, please. The title of today's presentation is Sexual Health, Tools for Professionals to Promote Sexual Empowerment for People with Spinal Cord Injuries. The speaker for today's webinar is Dr. Melina Longoni. Dr. Longoni is a medical specialist in the physical medicine and rehabilitation. She specializes in hyperbaric medicine, wound care, natural therapies, and pediatric rehab. She is the medical director of the ReDel Rehabilitation Center in Buenos Aires, Argentina, and medical staff at the Los Madroños, Madrid, Spain. She is also a professor at the AIACH Master's degree program in wound care at UAI University in Buenos Aires, Argentina, and professor of the Master's degree program in Clinical Neuropsychology at the University of the Americas in Ecuador. She is president of the Latin American Committee for Rehabilitation Research and vice chair of the Asia Americas Committee. She also conducts research at the Inter-American Open University in Argentina. Dr. Longoni, welcome and thank you for presenting. Next slide.
Well, thank you so much, Angie, for that presentation. Well, actually, I'm really excited to be here today with you, and I'm really thankful to participate in these webinars. So today, we're gonna talk about a topic that actually I'm really excited about, because we're going to talk about sexuality, and we're not gonna talk specifically about sexual dysfunction. Probably most of the people that actually are watching this webinar right now are healthcare providers. And often us as healthcare providers are really more or less comfortable about talking about dysfunction because it's something that we actually learn in college. Dysfunction of any organ, because we actually know what to do. We know which pill to prescribe, which medication or procedure, because it's something that we know that we can apply our knowledge. But when we have to talk about sexuality, it's so much more than that. It's not just sexual dysfunction. And I actually really like this talk in particular, because it's like something that I'm going to share with you. And it's going to be something that you're going to have to do with yourselves before you talk to your patient with spinal cord injuries. So we know that when we have to approach sexuality or sexuality, the issues regarding sexuality in people with spinal cord injuries or disabilities in general, there are two fundamental pillars. First of all, the health issues, and the other pillar that is a little bit more difficult for us as providers in this issue in particular, which is education. So here I bring you the concept of the WHO, that actually what sexuality means. And the WHO says that sexuality is a global dimension that mediates the entire human being, regardless of their intellectual endowment or motor skills. Well, the thing is that if I could ask each one of you, what do you think about sexuality? You're going to give me, all of you are going to give me a different concept of what you think about sexuality. Because it's something that it has a lot of things around it. Sexuality is a very sensitive topic in every society. And it would be different if I have this lecture here in Spain or in Latin America, on the US. Probably it's going to be more or less the same, but it's not going to be the same in other countries, which sexuality has another myths, another issues, another culture, another religions. So this concept is going to be different for each one of us, in spite of what the WHO says, right? So the thing is that we don't have that much information about sexuality when, as healthcare providers, when we have to talk about sexuality with people with any person. Actually, there's not that many information for us to talk to people about sexuality. So there's even less information about sexuality for people with disabilities, and even less information when we have to talk specifically to different kinds of disabilities. So that is a problem for us. So we have to start somewhere. We are healthcare providers, so we have to do all the things that we do as healthcare providers, the things that we actually learn in college. What are those things? We're gonna do a clinical history, the same clinical history that we do for each patient that comes through the door and comes to our consult. But we're going to do a specific clinical history regarding the sexuality of that person, because we're going to treat that thing in particular. Sometimes this is very important for us because it has a different relations. We have to actually develop a different relationship with your patient. Any patient is going to ask any professional about the wheelchair, is going to ask them about the DMEs, or even the catheters that they actually use for emptying the bladder. But they are not going to ask any person or healthcare providers about the sexualities. So even though we have to have an open mind, we have to have a different relationship with the patient. The confidence that the patient has on us, it's going to be very important, because we have to have a different sensitivity than another professional that treats different kinds of things. So what information are we going to collect in that clinical history? First of all, the premorbid conditions. You all know what premorbid conditions are, but we're going to talk about specific information about premorbid conditions regarding sexuality. I'm going to talk a little bit more in the next slide. Of course, we have to do the physical and neurological exam that we always do for patients with spinal cord injuries. In this case, we're going to do the same things that we actually do. We're going to do the INSCI exam. We're going to get the degree of neurological level of injury, and everything that we actually do when we examine a patient with spinal cord injuries. Of course, we have to do the specific education regarding that subject to the patient, the family. We have to do, of course, the follow-up. And if we have to do a specific thing with that patient, we have to refer if necessary. So, sorry, when I said that we have to collect the data about the primary conditions, that I actually said they have to do with the sexuality of that person. We have to take into account a lot of things. And this is something that I actually say that we have to do it first as healthcare providers and then apply to the patient. Why is that? Because we have to do this biography of ourselves. What do I mean when I say biography? We have to take into account or just start reflecting on what we think as providers, as healthcare providers, and as individuals. What do we think about sexuality? And this is the thing that I was saying before. We have different opinions, we have different concepts regarding sexuality. And it's not random. Actually, what we think about sexuality, it becomes from how we were raised, what was our culture, what we think is right, and what we think is wrong. So this is something that I actually encourage you to do, because you're going to have to take everything that you think is good or wrong away from this. You're going to have to clean your concept from myths and prejudice. Why is that? Because we have this moral compass. Each one of us has this moral compass, and we actually think what things are good, what things are bad, and we don't have to judge people when it comes to their sexualities. Because maybe we could have like a patient in our consult that actually wants to do, I don't know, a threesome or have some fetishes. And we think that's something like is horrible and that person shouldn't do that. And that is something that we have to actually think about. We can do, I'm not saying that you have to do it. I am saying that you have to open your mind and actually think. You don't have to judge the person on what they like or don't. You have to give them advice to do it in a healthy way. So you have to, when I say this biography, we have to actually know the person, what they actually do, what they think about sexuality. How do they live their sexuality? Did they have sexual intercourse, or they have experienced their sexuality before the spinal cord injuries? Did they think they won't have? Do they have some myths regarding sexuality now that they have a spinal cord injury? So that information is really, really important, because it will reflect on the quality of life that they have and they experience after the spinal cord injury regarding their sexualities. Because sexuality is something that is part of us, is part of our personalities, on who we are. Today, everything that you do, it has an aspect of sexuality in it. I'm saying sexuality, I'm not saying sex intercourse, I'm not saying that. I'm saying sexuality. If you think about it, all of you maybe today, before you went to work, you actually comb your hair, you could use makeup, or maybe, I don't know, use an outfit that you think it's cute. So all of that, decisions that you made, are based on your sexuality, are based on your self-expression, on your body image. So everything that you do, every moment, has like a little bit of sexuality on you, so on your actions. So that is important to know about your patients as well. So that is something that I always do with everybody that comes to the lectures. I say, okay, this is an exercise we're going to do ourselves and feel comfortable in our skin about our sexualities, because it's the only way that we can give information to another person about sexuality. So the other things are, of course, specific to sexual function, which is secondary dysfunction. If that person had a sexual dysfunction before the spinal cord injury, we have to, of course, take that data into account. The civil status, the identity and gender. We already know that this is a very important issue, and this is a thing that actually I really talk to the providers when they want to advise people with different disabilities in regarding sexuality, which is sometimes us as providers actually say things not very consciously, or we're not aware about giving some things to the person that actually are not very good. For example, I have some students that actually, when we do these role playings to get them comfortable talking about sexualities, they ask me, do you have a boyfriend? Do you have a husband? When they want to know a civil status. So that is something that is actually conditioning the person, because you actually are thinking that if I am a woman, I would like a male, and either way. So this is something that actually conditions the person, because you're prejudging, and you're actually conditioning the person of saying, okay, this is not the person I really want to talk about this issue in particular. So everything you say, even the expressions in your face that you do during the consultation and what the patient is telling you is important on the way that person is feeling and what is going to tell you, so you can actually give them some advice and treat them. So the other thing is, of course, cultural conditioning. There are a lot of cultures that actually don't express sexuality as we do. For example, in Latin America, people are really free with their bodies, and we actually know that some cultures actually believe that their body is sacred and they don't show it, or even though the women that actually use cover their hairs, because of course it's related to their religion. So that is something that we have to respect. We have to know the culture and the religion of the person to address this issue. The other thing is, of course, the pre-existing conditions. If that person had pain during sex, before the spinal cord injuries, or if they had depression before, or if they were in menopause, or if they had pain during sexual intercourse or dyspareunia in case of a woman, and another different conditions that actually can have an impact on sexual function, such as hypertension, diabetes, or others. And of course, all the medication that person is taking. The medication that they took before the spinal cord injuries and the medication that they are taking today, because we know that some of the medications that those people actually use, such as baclofen or some antidepressants, actually have an impact, direct impact in the libido or the erections or achieving orgasms itself. So they have an impact on the spinal cord injury or in the sexual function itself, not because of the spinal cord injuries. So we know that, well, male sexual behavior, we're going to talk a little bit about sexual function, of course. We know that sexual behavior in men includes 4 different phases. One of them is sexual desire, erection, ejaculation, and orgasm. All of them can be affected by the spinal cord injury. You could say, okay, why sexual desire? Sexual desire is something that you have on your mind, is what you desire. It's actually, if you have a spinal cord injury, that wouldn't be affected. But the thing is that sexual desire actually is very related to another thing that I already told you, that was how I feel, my self-confidence, the body image. And that has a very direct impact on people with spinal cord injuries, specifically in men and of course in women. It's going to affect, of course, the erection, it's going to affect the ejaculation, and it's going to affect the orgasms. About 40% of men with spinal cord injury report lack of satisfaction in their sex life. I'm going to show you in a little bit a study that we did with spinal cord injury individuals in Latin America and a study that we did with professionals in Latin America regarding sexuality. And I'm going to share with you some testimonies that we actually collected for a book that we're writing about stories of people with spinal cord injuries. And you're going to see it like really clear of what I'm talking about when I say they have an impact in the sexuality and not just sex function. What about women? We actually know that for many years, we didn't have that many information or studies for spinal cord injury women because they think, okay, the only problem that women have is lack of lubrication. It's not the same thing as men that can get an erection, and they didn't study a lot of things regarding sexuality in women. In the last 10 years, actually, a lot of healthcare providers started doing a lot of research in women and starting realizing a lot of things that happen to women after a spinal cord injury regarding their sexuality. The female response actually has 3 different phases, which are desire, the same thing that I said before, the psychological state characterized by sexual interest and motivation. The same thing happens as the men, that actually they feel less attractive, and it has to do with the body image and the way they feel. The arousal, which is the increased blood flow to the genital organs and clitoris, and the orgasm. So I'm going to take a little bit more time about the affection of sex life in women in particular, because as I said before, you're going to find like thousands of papers regarding the impact on sexuality on men, but not that many women. And of course, I'm a feminist, so I really like to share data on women. So the affection of sex life in women actually are limited by the emotional factors and the physical limitations. Of course, medication has an impact mainly in the libido of the woman and the desire. Sometimes women don't even feel that they want to have sex with or have intercourse, or don't feel attractive because of the medication that they're taking. Of course, it's important the level of injury, if they have severe spasticity, pain, or autonomic dysreflexia. And this is like really curious because 80% of the women in this study that I'm showing you right here, 80% of the women restarted their sex life after spinal cord injuries. But the thing is that actually the women that don't start having these relationships are due to physical problems, decreased sexual desire, low self-esteem, and feeling unattractive. But the main thing of the women that actually do start getting this or trying to get their sex life back is because of the need of intimacy that they have or they need with another partner. So it's not like the same motivation for men, even more so for Latin American men specifically, because they have to like prove that they're still men, and they can get erections and they can satisfy the woman, and they are trying to prove themselves that they are still men. For women, they actually get started in their sex life again because they really need this intimacy with the partner. So these are some of the studies that actually I told you before. This is one that we published last year that was sexual health and sexual quality of life among individuals with spinal cord injury in Latin America. We actually did 2 surveys, one of them for spinal cord injury individuals and another one for providers. So we wanted to see the perception of the people that live with spinal cord injuries and how they live their sexualities, and what information did they get from their providers, and then what the providers thought that they were doing for their patients. So this is something that I really like, this question, because it doesn't have to do specifically with the spinal cord injuries. And this is something that I always encourage you as well to actually think about. I'm 39 years old, and when I was in high school, actually I didn't have sex education. The only education that I had was regarding sex-transmitted diseases or contraception, but I didn't actually have an education regarding feelings, orgasms, their relationship, to have a healthy relationship with another person. And I really encourage you to think about if you have that kind of education. And the thing is that the education, it's already, we have a lot of papers published in that the education that kids have regarding sexualities actually get them from another kid. So what information do we have about sexuality and about sex health? So this is something that we actually ask people. Did you get sex education at some point in your life prior to your spinal cord injuries? Well, more than 50% of the people said no. Actually, we're self-taught or ask another person about sexual intercourse or about sexual health. I say this because this is very important. Because when we have a spinal cord injury person, an adult in the consult, and we start talking about sexuality or sexual dysfunction, we start talking from a level of education that we think that person has. But we don't ask them, do you know what an orgasm is? And you would be surprised how many people don't even know what an orgasm is. What information do you have regarding sexuality? What information do you have regarding sex health? So that's a good starting point, because we have to start from basis. That's different from the other things that we actually treat as rehab professionals or healthcare providers in daily basis, because everybody knows it's very easy to, or relatively easy to train a person on how to use a wheelchair, or how to train them in doing a catheterization or a bowel program is more mechanical, if you will. But this information, we actually don't know what the person knows about sexuality, sexual health. So this is a good starting point when we have the patient in front of us to actually know or actually find out what they know about sexual health and sexuality. So as I was saying before, this is one of the testimonies that I was telling you about. This is from a patient from El Salvador, which is a country in center of America. That he said, this is something very, very common. I didn't have sex education at school, and in this country, people don't talk about it. That's like really common for all people in Latin America. We're talking about a person which is in their mid-40s. Nowadays, there's some kind of movement that is going to, or is trying to put sex education in the table there, because we need it. But from our point of view, our ages are, we didn't have that information. Mainly, the information became from our parents. And what he said is really true. Actually, he thinks that women or girls actually are more educated because we have more information regarding our periods or the change of our bodies. And that's the information that we have regarding sexuality. So this is specifically related to spinal cord injuries. Did you notice any change in your sexuality after spinal cord injuries? Most of them, of course, 90%, almost 90% of the people actually said, yes, I actually noticed some changes. But what we think as providers is, okay, yeah, we actually know that they don't have the same way of orgasms, or we actually think that the changes are mainly or only in their genitals. And that's not the case. I really like this quote from one of the spinal cord injury women that actually we interviewed. And she said, since the accident, I have a body image that was put together like a puzzle, since it changed everything, from the features of my face to my muscles. I saw myself in the mirror and I didn't recognize myself. I had to do a lot of inside work. I don't feel attractive at all. So this is something related to body image and not specifically to sexual dysfunction. So that is why I say that we have to address sexuality in its whole dimension and not just sexual dysfunction in the genitals, right? So the other question that we did was, did you notice any changes in your ability to have an orgasm? And 46% said, yeah, I have noticed. 41% said after spinal cord injury, I never had an orgasm. Only 10% said, I haven't noticed any change. And 3% actually said, I have not had an orgasm in my life. And that is why I was telling you, there's a lot of people that actually don't even know what an orgasm is. So in order to re-educate their bodies, we have to make these people that actually not having an orgasm or not know what an orgasm is, try to feel a sensation or something related as that information that their bodies, the body changed. So they have to feel that thing again, and we have to re-educate their bodies. So this is, I really like this, these two quotes from a man and a woman, and they both think the same, that the way that they feel the orgasms are actually more brainy. They said, I have this, one of them, which is Carlos, both of them are from Argentina, and one of them said, okay, I'm feeling different. They start feeling different because they actually start thinking different. They are not focusing anymore in their genitals, they're focusing on everything, in their whole being. And this is something that we try to do. We are trying to educate sexuality, everything in their sexuality, and not just sexual dysfunction. I'm going to go a little bit more fast because I think this is taking forever. Sorry. So did you get any information about sexuality after spinal cord injury during your hospital stay? This is very important because a lot of people, the majority of the people said, I didn't get information in the hospital. They cannot look for information if they don't have the information from their providers. So this is very important. I want you to remember these numbers because the patients said, most of them said, no, I didn't get information. 82% of the person says, of the spinal cord injury individual said, I didn't get information. I want you to remember this because we asked the same thing to the providers and you're gonna see what they said. So this is one of the quotes that I actually love that says, not all professionals answered my questions about sexuality, so I decided to investigate on my own. This is very common for people with spinal cord injuries or disabilities in general. When they don't get the information from their providers, they start looking at whatever, and not always they get the right information. And the other quote that I really like is from a girl that actually she can only move her head, sorry. And she said that after the accident, nobody informed me on how my sexuality was going to be. Whether or not everyone accepts their new situation, the information must be there. We need it desperately. So then we asked them, has a professional ever asked you if you had problems or difficulties on your sex life after spinal cord injuries? Of course, the majority said no. The amount of information, of course, is going to be really low or not get information. And if you didn't get information, would you like to get information? So the answer of 90% and 98% of people said yes. So this is another quote of, these are two of my spinal cord injury patients, but this one is actually a quote that I like, because he said it's a patient that had a spinal cord injuries for several years, and he said, when you're injured, you have many doubts, and would be ideal to have advice not only from your providers, but you should have information from another person that actually has or is living the same things that you are. And this is very important, because sometimes we actually quote unquote use or invite people with spinal cord injuries to share their experience in first person to other people that are actually living the same thing. Because a lot of patients said, okay, you have all the theory, you have the information, but you're not living what I'm living. So they don't feel like you're in the same place. So sometimes to invite another person that is empowered in their sexuality after a spinal cord injury can be very useful for your patients. So all of them, we asked them when's the best time to get the information, and most of them said during their rehabilitation. And that's very, very important data, because it's not something that we actually put it like in the agenda of the program, of the rehab program. We actually write, okay, we have to, sometimes because we don't have that time, because this is not something like you could do in a 15 minutes visits, and you have to, maybe you have to talk to the patient for 2 hours and you have to give them that time. It's the time that it takes for that person to open up to you and talk about sexuality. So they would like to receive the information from a healthcare professional. If they have if they are a sex educator or a counselor, it's of course an information that they use. And it's very important to treat their problems, their sexual problems after a spinal cord injury. This is for Latin American people, but there's a study from Kim Anderson from 2015 that actually studied a large amount of people with spinal cord injuries, and sex health or sexual problems were the first in a problem to address in paraplegic, and the second problem to address in quadriplegics. So this is some information or quotes that I put from the book. That this is from Marcelo. Marcelo is a spinal cord injury individual. You can see him in the picture. He also is PT, and he's part of the Committee of America's Committee. And he's, of course, very young. And I took this quote from two young people, Marcelo and Sofia, that actually emphasize the issue of sexuality that is very important to them. And they say it's between 70 and 80% of the relationship. So it's something that we have to address. We have to address the bladder, yes. We have to address the bowel, yes. We have to address everything, but we have to address sexuality, because in the long term, it's going to be the thing that they all want to address. So when we actually asked them, and I really like this data, because when we said, okay, which topics would you like to address during the therapy or the rehabilitation, and we thought, okay, maybe men want to get information about different devices to get directions, and women about lubrication. And actually, you can see here that the first thing that they want to know is how to communicate with their partners after their spinal cord injury regarding their sexualities. This is like, I really actually like this, because it puts out there then the need of information that they want, because they need for their relationship with their partners. Not just for them, for the partner as well. This is a quote from Marianela. Marianela is also a C4 spinal cord injury patient. And this is very important regarding the relationship that they have. I always mention that after the injury, sexuality becomes something that takes a long time, different spaces, and perhaps the person who is with you does not have the necessary patience to accompany you in this process. So that is why the importance of addressing sexuality with the spinal cord injury patients and with their partners. So when we actually did this survey for professionals, and we wanted to see how professionals treated or addressed the issue of sexuality of people with spinal cord injuries. So first of all, we actually asked them if their institution actually had a program regarding sexuality or to address sexual difficulties after a spinal cord injury, and 75% of them said no. And we actually said the same thing, asked them the same thing. Did you get sex education during your study plans? Did you get sex? We are talking about healthcare providers. So I think this is a little bit scary, because only 50% of them said, yeah, in my, I don't know, college or high school, or I got sex education. Why we don't have the 100% of them saying, yes, we had sex education during our healthcare course, or when we were doing medicine, or whatever your profession is regarding healthcare. So when we asked them if they were prepared scientifically or therapeutically, or they have education or the educational level to address this issue with spinal cord injury people, the 62% of them said no. Do you think that the way you see sexuality affects your approach or the approach that you do with people with spinal cord injuries? 56% said no. So that is why I ask you, if you're going to treat patients or advise patients in regarding sexuality in spinal cord injuries, you have to do, first of all, your own biography. Because most people think, okay, it doesn't matter what I think about sexuality. It doesn't matter if I think it's right or wrong. I will address it as I wish, or as my experience, or whatever I think it's good or wrong. So I think we should really do, I think we should look ourselves before we start treating people or advising people regarding sexual health and sexuality. Do you think sexuality is an issue that should be addressed? Most of them said yes, and that's very good. But the thing that's not very good is that they said, yeah, okay, so if you count these 35% and 25 on I don't know, maybe between 70, 80% of people or professionals that actually treat spinal cord injury patients treat in some way or talk in some way about sexuality in spinal cord injuries. But I told you, please remember what happened when the patients were asked if they had information from their providers. 80% of them said no. So 80% said no, I didn't get information. And when we asked the providers, 80% said, yeah, I'm talking about sexuality with my patients. So what's going on? Is the information not correct? Do we have a wrong perception of what we're saying or what we are talking about when we are giving information about sexuality in people with spinal cord injuries? So the main reason that professionals don't talk about sexuality in people with spinal cord injuries is because they don't have training in the area. Do you consider that talking about sexuality is important for healthcare, for health of people with spinal cord injury? Of course, 98% of them said yes. So what kind of interventions can we do? So I'm just gonna go really fast because I can give you information, or if you want after. This is the model, the implicit model. You can see it in the last year. Oh, no, sorry, in 2020, AIACH actually published 19 guidelines for healthcare providers or primary care providers, and one of them was about sexuality. They are free, you can download them for free, and we actually translated them into Spanish. So you can actually read this, this paper is free, and actually it's very easy to read. And it's going to give you a whole vision on how to treat patients with spinal cord injuries regarding sexuality. You have another resources. There's not that many resources, but there are some resources that you could use with your patients. One of them is the webpage of Dr. Michel Tepper, that also wrote the guide for AIACH regarding sexuality. And I really like this webpage because you have different videos and different resources for your patients. So if the patient has spasticity, or if the patient have some issues like they are incontinence, and it gives you a lot of tips to have a better quality of sexual intercourse, and another information for regarding sexuality in general for people with spinal cord injuries. There's another book in Spanish, which is, the name is Silla Sutra. It would be like Wheelchair Sutra, the version of Kama Sutra for in wheelchairs, if you might. So it's some information that you could actually have for your patients, and it's a good starting point to start discussing the issue. If the patient is not like willing to talk about, because they are embarrassed to talk about the issue, so it could be like a good starting point. You can give them these resources, and they could read them and ask you afterwards. In 2020, we actually did this book. It's a booklet. We have it in Spanish and we translate it into English. It's actually a book that it's for disabilities in general. So you can give it to your patients or to the families, or you can read it yourself. And it gives you a lot of things regarding sexuality in general, and sex, and other aids for sex function as well. And you have these kind of things, really cute things that our OT did for patients for low motility. Is for instance, for a quadriplegic woman that could use this glove that has sensitivity thing from one side, and the other is a bullet. There's also some things that you could do with your OT. So there's a lot of things that you could actually adapt for your patients. I actually, when I do these workshops with my patients, I give them a lot of information at first, because some of them actually are embarrassed when I show them the sex toys. And then when we started talking and they see that everything is really cool. So I take the sex toys, and they see like a lot of possibilities. And if they want something, we could adapt that thing that they like for themselves or for their partners. So we have some DMEs specifically for sexualities that you could buy in sex shops. It's not specifically for spinal cord injury patients, but they are very useful, like constriction rings or penile sleeves. And there's DMEs specifically for an ejaculation, which is, this one is really, really specific for SCI. Maybe you know it, the name is Ferticare. Is a little bit expensive for spinal cord injury patients, especially in Latin America, but it has a specifically vibration that actually helps the patients the male patients to ejaculate. There are also some books for patients, a guide that this guide is from Dr. Macari Alexander, which is one of the main researchers in sexuality, and specifically in women's health and sexual health. And we actually translated that in many, many languages. We did the Spanish one, but we have them in Greek, Italian, Romani. Then there's this information that you also can download them for free, which is pleasure able. You can see a manual with a lot of sex toys, positions, and everything for spinal cord injury patients. And then there's the guide that I already told you about that you have in English, and we translate it into Spanish, and you can download them for free. So what are the general recommendations? Don't wait for the consultation. So many of the students actually say, okay, when's the right time to talk about sexuality in people with spinal cord injuries? And you could actually hear, no, that's the psychologist should talk about that when the patient is ready, when he asks you, or maybe he will never ask you. So you're gonna have to talk this from day one. You're not gonna impose the subject. You're gonna say, as you have different ways now of moving or to empty your bladder, you could have some sex dysfunction, or you could have an impact on your sexuality. So this is a problem we can address whenever you're ready. So that person already knows that he or she or they can talk to you about the subject in the moment that they want, if it's day one, or if it's, I don't know, 6 months later. The other thing is that we have to take into account intersectionality for cisgender and LGBTQAI+. And I really like this quote, also is from the book, because it's one of a spinal cord injury woman that is also a lesbian. So this is very Latin America. This is a very Latin American way of thinking, because it's something that I already told you about. We have a lot of things regarding sexuality that has taboos and prejudice and a lot of things and beliefs that are not right. But we think as a society, that's the thing that we think. So she actually said, one health provider once told me, disabled and lesbian, isn't that too much? So the other thing is that I think this is very important. This is for us as well. The education of the professionals should include actually techniques that increase the level of comfort in addressing sexual concerns and understanding how medical conditions can affect the biopsychosocial functioning of sexuality. And of course, this is not something that we can address only us, because we have to talk about sexualities, body image, the preparation for everything, the management of the bladder, the management of different positions, how do we move, how do we feel. So it is very important to have a team that actually thinks the way that you think, that sexuality is important for people with spinal cord injuries. So that's it. I really love this quote from Nish that says, to love sexuality is to love life. The veneration of the creation of life is the triumph of life over death. Thank you.
Wow, thank you so much, Dr. Longoni. That was an excellent presentation. So at this time, we'd like to open it up and invite the attendees to type in questions into the Q&A in the Q&A box, and we can address those. Maybe everyone's writing at the same time. We're going to get an influx. I don't really have a question, Dr. Longoni, but I think that's such an eye-opening presentation, especially what you pointed out, where folks said that they were not given any kind of education, sex education, and the providers think that they're providing it. So that's an interesting dichotomy there that obviously needs to be addressed. I think people are being shy. Well, I'll just say thank you to everyone for attending today's grand rounds. And if you do have some questions afterwards that you haven't had time to ask, please feel free to reach out to our presenter directly and she can follow up with any questions. So the recording for this webinar will be posted soon on the SCIMS website with a link to our YouTube channel. And as a reminder, please see the chat information on how to obtain those CME credits for attending today's webinar. And at the end of the webinar, a brief 3-question survey will pop up. We'd appreciate your feedback. We also hope you can join us for our next grand rounds, which will be on Thursday, March 2nd at noon Central. And that's where Drs. Morse, Mondin, and Battaglino will present an overview and current state of our Minnesota Regional Spinal Cord Injury Model System. So thank you, everyone, and have a wonderful rest of your day.
Thank you.